and good morning. I'm Dr. Deuk. I'm here with one of my lovely patients. She's from Bermuda, and she traveled to Deuk Spine Institute because she had Piriformis syndrome and sacroiliac joint pain. And we just did her surgery yesterday. You could see it in the video. We went in and released the piriformis muscle in a minimally invasive way that we developed here at Deuk Spine. It's only done here at Deuk Spine. And we did a Deuk plasma rhizotomy on her sacroiliac joint. You came to us with horrible pain. You weren't walking straight. How do you feel today?
I feel good. I still a little stiff because I got to get used to walking properly all over again, but I'm feeling really good. When I saw you on YouTube, I realized this was for me because I didn't want to get all these nuts and bolts and all that kinds of things. And I'm a person like that. I like to be different. And I knew right away you were the person that would do that.
So you're happy with your decision?
I am ecstatically happy. I am very happy.
What's life going to be like now for you?
I am going to go back to lifting my weights and exercising. Well, not right away, but I'm going to be doing that.
You know, we talked about kind of getting you back into the bicycle and
Yes.
the gym. What was life like for you in living in pain?
It was horrible. I remember my husband go to work days because I'm retired. I would be home crying. I was in tears because I wasn't getting any help. The help that I was getting was just, oh, can I see your x-ray? Basically, they need to stop the x-ray thing and look at the person, touch the person.
That's right.
Yeah, and feel and see what's happening. And that's what I got with you. You poked me and popped me and it's here, it's right here. And I like that. I like that.
X-rays never tell us
Tell
where
the
pain,
story.
they don't tell where pain comes from.
No, and that's the thing that I find that is wrong with my other doctors. They look at the x-ray. I mean, some people could be not having if they have a bad x-ray.
That's right.
Yeah.
You cannot use the MRI or X-ray findings to tell where the pain's coming from. You have to look at the patient's body and figure it out.
Yes, and I like the fact that you did that, and I'm feeling so much better. I'm happier. I really am, because I know I'm going to go back and start doing the things that I was doing before.
You've been through so much with this back pain.
Ugh. Tears was really bad. All the acupuncture and the this and the that. And I went all out on everything, and
You tried medication.
everything.
You tried shots.
I tried all those things, and nothing worked. So, but I'm glad it worked now, because in the past, everybody was trying to talk me into doing these other operations.
The fusions.
All this and all this. So I'm glad that I decided to take it into my own hand and start looking and searching for someone that can do better for me.
That's right.
No nuts and bolts. I call them nuts and bolts because that's what you get.
Doctors will recommend treatments that they are making profits on from patients rather than the best treatment for you. The best treatment for you is one that cures the pain so you don't have to keep coming back.
Yes.
And we're the only ones that can do that.
And then maybe they're not trained in that sort of those kinds of things.
They're not trained in it because
and it's sad. And there can be.
Well, they can, but they would have to come here, and I can't train all of them. There's too many doctors. But where they're being trained the wrong way. And that's the problem. And they're going out and practicing the wrong way to treat back and neck.
Oh, yeah. Okay.
So they come to patients like you and they tell them to do these old treatments that don't work.
Yeah.
We have new treatments that do work.
Well, yes. And I had my back done. Stenosis, that is fine.
Good. I'm glad you're happy.
I wish I could have gotten everything done at the same time.
Yeah, you had more than one problem. You had the disc, you had the piriformis, you had the SI, and the facet. But we've treated it all now.
Yes.
And you happy?
I'm very happy. I really am. And I know I'm going to go back loving my husband again.
Good for you.
Take them apart.
That's okay. Your husband needs to be loved. We all need love. And now you can focus on your husband. Now you can focus on him.
Yes. I'm always focused. My husband is amazing. He is such an amazing man. He always know what I need.
He's been with you the whole time, by your side throughout this.
Yeah, and that's what women need. A man that is there for them to help them,
Well, congratulations.
Thank you.
It's great to see you.
Thank you, Dr. Deuk. I really appreciate you. And listen, your staff is amazing. You can't put on that. You really, really can't. They're all of them are amazing. Every last one of them. And I'm not saying that because you're here. Maybe you need to give them a raise.
I could afford it. But thank you so much. I really appreciate it.
Yes.
All right, great to see you.
Yes.
Safe travels.
Thank you.
Let's get you out of here. You don't
Take the
believe?
loving part.
No, we're not taking that out.
It was funny.